your mental health. Brought to you by Barber Behavioral Health, a service of Barber National Institute.
And we're going to welcome in our first guest today. Andrew Haidt is a behavioral analyst from Barber Behavioral Health. Andrew, welcome. It's nice to have you with us today.
Thank you so much for having me.
Yes, and we're talking about a special program in working with those with autism.
Yes, so ABA, Applied Behavior Analysis, is what we're talking about. And ABA, just to kind of give an overview of what it is a scientific field of study that's rooted in behaviorism and the principles of operant conditioning. And what that means is behavior analysts will take all the principles and the fields of study in that area, all the research, studies done over the past 80 years or so, and we take that knowledge and we design interventions and apply it to something that's socially significant for behavior change. So you'll often find ABA embedded into educational settings, mental health settings, corporate settings, and it's been pinpointed and kind of designated as one of the most effective treatments for autism.
And I would imagine it's very customized to who you're working with.
It is. ABA is definitely going to be designed specifically for the individual. And so that means that treatment plans are going to be designed around the individual based off of what their needs are.
And what type of things does it pinpoint specifically with children with autism?
So with autism, unfortunately, sometimes problem behavior comes along for the ride. And that's one of the main things that a behavior analyst will do is treat problem behavior. And we do that by finding out what the functional relationship is with the behavior and the environment. So why people, the purpose of their behavior, the reason for the behavior. And when we figure that out, we can then begin to design interventions to treat the behavior, reduce that behavior, at the same time, try to teach a more appropriate functional, appropriate behavior that will kind of serve the same function. So, I'm sorry, just a basic example of that would be, maybe a child in school is having problem behavior or exhibiting problem behavior, and they get sent out of the classroom. Well, maybe they wanted that, and maybe it might be more appropriate to teach them to ask for a break. That's just a very simple example, but you kind of see kind of the same function there.
So if parents are starting to see some behaviors in their child, where do they start with ABA?
Sure. So basically, and I saw you guys talk to Dr. Barbara Carey about early intervention. So the earlier you can intervene, the better.
Sure.
So that's very important to get in as quickly as possible. But as soon as, if your child has autism or a qualifying diagnosis, it's just very important to reach out to any local provider, the Barber Institute being one of them, talk to somebody in the IBHS field, which is Intensive Behavioral Health Services. They can kind of walk you through the whole process and kind of begin to find what services might be most appropriate for that individual.
Because the parents have to be involved in this.
They do.
Or it's not going to work.
The parents have to be involved. It's definitely a collaboration between educators, caregivers, anybody who works with a child.
Yeah.
And it's as I said, it's very important to get in early and reach out to those local providers to kind of figure out what those services are.
We so often take for granted the Barber National Institute in our area, and just how invaluable it is to families who are dealing with autism, and then the Barber Behavioral Health as an extension of that. And it's a great place to start to see if the services that you all provide could help.
Sure. I mean, the Barber Institute is one of many programs, or is one of many providers in the area. And Erie's pretty lucky to have as many providers as we do.
Yes. Andrew, thanks for joining us today. We do appreciate it.
Thank